Hello everyone and welcome to a new video. So here we will talk about the differences between the syndrome of inappropriate antidiuretic hormone secretion and the diabetes insipidus. Those two conditions are confused and mixed by a lot of students, but here we will make them clear what are the differences between them. And I also put some pictures to refer to the presentation of each of those diseases. So the picture on the left refers to the SIADH presentation. The patient usually present with headache, nausea and vomiting because of the cerebral edema caused by the hyponatremia from the SIADH disease. And the right picture here refers to the diabetes insipidus presentation. The patient present with polydipsia and polyuria, so they drink a lot of water. So SIADH and diabetes insipidus are both disorders affecting the antidiuretic hormone secretion. This is the only hormone they affect. The ADH hormone secreted from the pituitary gland and works on the V2 receptors in the collecting duct of the kidney to absorb more water from the duct into the circulation. SIADH is excessive secretion or release of the antidiuretic hormone from the pituitary or other sources such as tumors, and this leads to more water being absorbed, and this leads to delusional hyponatremia and more fluid in the circulation of the human body. The diabetes insipidus is the opposite of the SIADH. The diabetes insipidus, there is deficiency or inadequacy of the ADH hormone secretion, leading to decreased water absorption from the collecting duct, thus leading to polyuria and polydipsia. Because of the less water being absorbed, this would lead to increase the urine volume, and it would also lead to polydipsia. The patient would drink a lot of water, reaching sometimes to 20 liters per day. And the diabetes insipidus on two types, the nephrogenic, where the V2 receptors doesn't work, or the central, the pituitary gland doesn't secrete ADH. So it is either the problem in the kidney, the V2 receptors are not working, or it is central, where the pituitary gland doesn't secrete the ADH hormone. So now you understand that with the SIADH there is increase in the ADH secretion, and in the diabetes insipidus there is decrease in the ADH secretion. Now the syndrome of inappropriate ADH, the inappropriate in the SIADH make students confused, thinking it could be increase or decrease in the secretion of the hormone. But in reality, it is always increase, but it is variable increase, and that's why called inappropriate. So the SIADH is always increase in the ADH, but it is variable increase. That's why it's called inappropriate. Diabetes insipidus, on the other hand, is a different disease than the diabetes mellitus. Some students will confuse it with the diabetes mellitus, but it is a whole different disease. It is called diabetes because it shares some symptoms with the diabetes mellitus, like the polyuria and polydipsia, but otherwise it is quite different. Next, the key differences between the two conditions will be explained. So let's start with the causes. So for the SIADH, it's caused by either tumors secreting the ADH, such as lung cancer, meaning external ADH secretion. Also head injuries, making the pituitary secreting more ADH, or medications increasing the ADH secretion, or any diseases affecting the pituitary gland or hypothalamus, leading to increase the ADH secretion and leading to the SIADH. The diabetes insipidus, on the other hand, is caused by either central cause by head trauma, tumors affecting pituitary or hypothalamus, leading to decrease the ADH, or nephrogenic cause, which could be genetic or acquired due to kidney disorders or medications. For the presentation, the SIADH, as we mentioned, present with nausea, vomiting, malaise, headache, lethargy, and seizures from the cerebral edema caused by the hyponatremia. because when there is more water in the circulation, this would lead to dilutional hyponatremia, and this would make the water being absorbed from the circulation and into the brain, leading to cerebral edema and leading to nausea, vomiting, malaise, etc. For the diabetes insipidus, it is present with polyuria, polydipsia, dehydration, and seizures. And all of those are caused by lack of ADH, making less water absorbed by the collecting duct and increasing the water in the urine, leading to polyuria and leading to polydipsia. Now for the urine output. So in SIADH, the urine output is reduced and urine is concentrated because the body is absorbing more water from the urine. In diabetes insipidus, the urine output is increased and urine is diluted because the body is losing more water. Regarding thirst, in SIADH, the patient doesn't feel thirsty as much as normal because they are retaining water, and in diabetes insipidus, the patients feel extremely thirsty and drink a lot of water because they are losing the water. Regarding the serum sodium levels, in SIADH, it leads to dilutional hyponatremia, low sodium because of the excessive water in the circulation, as we mentioned. In the diabetes insipidus, it is normal or high levels of the sodium. Regarding treatment, the SIADH is treated by treating the cause and restrict the fluid intake to prevent further load on the circulation and to prevent the further exacerbation in the sodium levels. While in the diabetes insipidus, you treat the cause also according to the type and cause and increase the fluid intake. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this video.